You start keto and feel awful. Headache, fatigue, nausea, maybe dizziness. It's tempting to label it keto flu and push through. But some symptoms are not a normal adaptation signal. They're a red flag that something else is going on. The goal isn't to scare you. It's to help you separate expected short-term discomfort from signs that deserve a pause and a check-in. Classic keto flu usually peaks in the first few days and improves as your body adjusts to lower carbs and lower insulin. It often responds to fluids, electrolytes, and a bit more rest. Red flag symptoms tend to be intense, unusual for you, getting worse, or paired with warning signs like confusion or severe weakness. In the next few minutes, you'll get a simple mental checklist. You'll learn what's common, what's concerning, and what to do next if you're unsure. Because toughing it out is not a strategy when your body is waving a warning flag. Moving to slide 2. Let's define normal first. Keto flu is a cluster of symptoms that can happen when carbs drop fast. Insulin falls, your kidneys release more sodium and water, and you can feel drained. The most common pattern is mild to moderate headache, low energy, brain fog, muscle cramps, and irritability. Many people also notice a faster heart rate when standing up because blood volume is a bit lower. The key detail is trajectory. Keto flu usually improves with basic steps like salting food, drinking to thirst, and getting enough potassium and magnesium from foods. It also tends to stabilize as your carb intake stays consistent. If symptoms are mild, improving day by day, and you can still function, that's more consistent with adaptation. If symptoms are severe, sudden, or paired with alarming signs, don't assume it's keto flu. Use keto flu as a hypothesis, not a diagnosis. Your body's feedback is data. Moving to slide 3. Here's a quick rule that catches a lot of problems early. Intensity, duration, and direction. Intensity means the symptom is severe enough that you can't do normal tasks. Duration means it's not easing after several days of stable eating and hydration. Direction means it's getting worse instead of better. Keto flu is usually a downhill slope. Red flags often look like a flat line or an upward climb. Another clue is mismatch. For example, you're salting food and drinking enough, but your dizziness keeps escalating. Or you're eating enough calories, but your weakness is extreme. Also pay attention to new symptoms you've never had before. Keto can change how you feel, but it shouldn't create scary, out-of-character signals. If you remember nothing else, remember this. Adaptation discomfort is typically predictable and improving. Unpredictable, escalating, or disabling symptoms deserve a pause and a more careful look. That's not failure. Moving to slide 4. One of the biggest, not keto flu signals is severe dehydration or electrolyte imbalance. Keto can increase water and sodium loss early on, but it shouldn't push you into a dangerous zone. Red flags include very dark urine, minimal urination, feeling faint when standing, a racing heartbeat at rest, or persistent vomiting or diarrhea. Muscle cramps can be normal, but widespread weakness, severe spasms, or palpitations are more concerning. Another clue is that symptoms don't respond at all to reasonable electrolyte intake. If you're already salting food and still feel like your body can't stabilize, that's information. Dehydration can also stack with heat exposure, intense workouts, alcohol, or not eating enough. If you suspect you're significantly dehydrated, the safest move is to stop pushing intensity, focus on fluids and electrolytes, and consider getting checked, especially if you feel confused, faint, or can't keep fluids down. Keto flu is uncomfortable. Moving to slide 5. Another category is blood sugar problems. Keto can lower blood sugar, and for many people that feels stable. But if you're using glucose-lowering medications or you're very sensitive to fasting, you can dip too low. Red flags include shakiness, sweating, intense hunger, confusion, blurred vision, or feeling like you might pass out. People sometimes call this keto flu, but it's a different mechanism. It can happen if you cut carbs and calories at the same time, skip meals, or add hard exercise too quickly. On the other side, very high blood sugar can also happen in certain situations, and it won't feel like typical keto flu either. The key point is that blood sugar symptoms can escalate quickly and affect your ability to think clearly. If you have a meter or continuous glucose monitor, data helps. If you don't, treat severe symptoms as a reason to pause and get support. Just push through is a risky approach when your brain is running low on fuel. Moving to slide 6. Now let's talk about a rare but serious situation, ketoacidosis. Nutritional ketosis is not the same thing as ketoacidosis. Most healthy people will not develop ketoacidosis from a standard ketogenic diet, but certain groups have higher risk, especially people with type 1 diabetes, and sometimes people with type 2 diabetes using SGLT2 inhibitor medications. The red flags are not subtle: deep or rapid breathing, severe nausea or vomiting, abdominal pain, extreme thirst, confusion, and a fruity or solvent-like breath odor. This does not behave like a mild adaptation phase. It feels like being seriously unwell. If you have diabetes and you feel very sick on keto, ketone testing and medical guidance matter. The safest mindset is this: if symptoms suggest ketoacidosis, treat it as urgent, not as keto flu. You can be committed to a nutrition plan and still respect the difference between normal ketosis and a medical emergency pattern. Moving to slide 7. Chest pain, pressure, or shortness of breath is not keto flu. Neither is fainting, one-sided weakness, or sudden trouble speaking. Keto flu can make you feel tired and foggy, but it shouldn't mimic a heart or neurological event. People sometimes dismiss these symptoms because they started around the same time as a diet change. That timing can be a trap. Another trap is assuming palpitations are harmless. A brief flutter can happen with stress or electrolytes, but sustained pounding, dizziness, or chest discomfort should be taken seriously. If you have known heart disease, high blood pressure, or a history of arrhythmia, it's even more important not to self-label. The practical takeaway is simple. If you have symptoms that could be cardiac or neurological, don't troubleshoot with salt and patience. Get evaluated. Keto is optional. Your safety isn't. It's better to be told everything is fine than to miss a time-sensitive problem. Moving to slide 8. GI symptoms are common on keto, but the severity and pattern matter. Mild constipation can happen when fiber sources change or fluids drop. Mild nausea can happen when fat intake jumps too fast. But persistent vomiting, severe abdominal pain, black or bloody stools, or signs of dehydration are not just keto. Another red flag is pain that localizes sharply, especially if it's worsening. Gallbladder issues can be triggered in some people when dietary fat changes, particularly if there's a history of gallstones. Pancreas irritation is another reason severe upper abdominal pain shouldn't be ignored. Also watch for ongoing diarrhea that doesn't settle, because it can quickly disrupt electrolytes. The practical approach is to simplify. Reduce extreme fat loading, choose gentler proteins, and keep hydration steady. But if you have severe pain, fever, repeated vomiting, or blood, stop troubleshooting at home and get evaluated. Keto flu doesn't cause alarming GI bleeding or intense focal pain. Moving to slide 9. Keto changes fluid balance, and that can change blood pressure. Some people feel lightheaded when they stand up, especially in the first week. That can be a normal adaptation signal. The red flag is when it becomes frequent, severe, or leads to near fainting. Another red flag is a new, persistent headache that's intense, especially if it comes with vision changes, neck stiffness, or neurological symptoms. Headaches can be from sodium loss, but they can also be from dehydration, caffeine withdrawal, or uncontrolled blood pressure. If you already take blood pressure medication, a sudden drop can make you feel weak and dizzy. The safest move is to treat repeated near fainting as a reason to pause and get checked, not as something to power through. If you can measure blood pressure at home, it gives useful context. The core idea is simple. Mild lightheadedness that improves is one thing. Recurrent severe episodes are a different category. Moving to slide 10. Sleep and mood changes are another area where people mislabel problems as keto flu. Some restlessness is common when carbs drop because stress hormones can temporarily rise. But severe insomnia, panic-like symptoms, or a dramatic mood shift deserves attention. If you can't sleep for multiple nights, your body will feel awful no matter what you eat. Another red flag is confusion that feels more than brain fog, or agitation that's out of character. Sometimes the issue is undereating. Keto can blunt appetite, and people accidentally combine keto with a large calorie deficit that can raise stress, worsen sleep, and make you feel shaky or anxious. Caffeine can also hit harder when you're dehydrated. A practical reset is to stabilize basics for a few days. consistent meals, adequate calories, earlier caffeine cutoff, and electrolytes. If symptoms are extreme or you have a history of mood disorders, it's smart to involve a clinician. Keto flu should not feel like losing emotional control. Moving to slide 11. Sometimes the keto flu feeling is actually a food reaction or intolerance. Keto often increases eggs, dairy, nuts, sugar alcohols, and processed low-carb products. Any of those can cause bloating, cramps, diarrhea, reflux, rashes, or headaches in sensitive people. Sugar alcohols are a common culprit because they can pull water into the gut. Another issue is histamine load, especially with aged cheeses, cured meats, and leftovers, which can trigger headaches or flushing in some individuals. This is where the timeline helps. If symptoms reliably spike after a specific food, that's not adaptation. That's a trigger. The simplest experiment is a short elimination. Go back to a basic whole food keto template for several days. Choose plain meats or fish, low-carb vegetables, olive oil, and simple seasonings. If symptoms improve, you've learned something valuable. Keto isn't one diet. It's a carb level. The food quality and tolerance still matter. Moving to slide 12. If you have a medical condition, the keto flu label can hide real interactions. Kidney disease, gout, pregnancy, a history of eating disorders, and certain endocrine conditions all change the risk profile. Even without a diagnosis, medications matter. Diuretics can amplify sodium loss. Blood pressure meds can make lightheadedness worse. Diabetes meds can change how low your glucose goes. And if you're restricting carbs while also restricting fluids, that's a setup for trouble. The red flag here is not a single symptom. It's the context. If you're on prescription meds, have chronic illness, or have had past complications with diets, you deserve a more cautious ramp-in. That might mean a slower carb reduction, more monitoring, and professional guidance. Keto can be a tool, but it's not a one-size-fits-all experiment. If your body is giving strong signals and you have risk factors, the smart move is to treat that as a reason for extra support. Moving to slide 13. So what should you do when you feel bad and you're not sure? Use a simple decision ladder. First, stop escalating. Don't add fasting, don't add intense workouts, and don't cut calories harder. Second, stabilize hydration and electrolytes for 24 to 48 hours. That means salting food, drinking to thirst, and getting potassium-rich low-carb foods like leafy greens and avocado if they fit you. Third, simplify your food choices to reduce triggers. Fourth, check basic data if you can: temperature, blood pressure, and blood glucose if relevant. Then look at the trend. If you're clearly improving, you can cautiously continue. If you're not improving, or you have any severe red flag symptoms we covered, treat it as a reason to seek medical evaluation. The win here is not staying keto. The win is learning what your body needs. A good diet should make your life more functional over time, not less. Adaptation is real, but so are warning signs. Moving to slide 14, let's close by making this practical. Keto flu is usually mild to moderate, early, and improving. Red flags are severe, persistent, or escalating. The biggest categories to respect are dehydration, blood sugar problems, and symptoms that could be heart, neurological, or serious GI issues. If you're in a higher risk group, your threshold for getting help should be lower, not higher. You don't get extra points for suffering. If you want a simple self-check, ask, can I function? Am I improving? And does this feel familiar? If the answer is no, pause. If you're unsure, get evaluated. One more thing, keto can still be done in a gentler way. A slower carb reduction, adequate calories, and a focus on whole foods often prevents a lot of misery. If you found this useful, make one choice in the comments, A or B. Did your worst keto flu feel more like dehydration or more like low blood sugar? And if you want more clear, cautious nutrition breakdowns like this, subscribe. This information is not a substitute for medical advice. Insulin drives the system. Understand it.